Good day, everyone. My name is Adanna Chukwuma. I am a senior health specialist in the Europe and Central Asia region of the World Bank. And today I'll be reflecting on my leadership project entitled Gender Responsiveness of COVID-19 Pandemic Plans in Europe and Central Asia. The pandemic is not gender blind. We have seen more women pushed into extreme poverty, more women losing their jobs during the pandemic, and more reports of violence against women. And yet, when we look at the responses, we don't quite see the same attention paid to the gender-specific impacts of the pandemic on women. For example, men are about 1.6 times more likely to have received cash support from governments or civil society during the pandemic. And yet we know that when countries are intentional about understanding and reflecting the challenges that women face in pandemic responses, that women are 1.6 times more likely to receive government relief compared to countries that do not. And so we narrow down our focus to Europe and Central Asia, a region that has been hard hit by the pandemic, with the highest number of total cases and the second highest number of total deaths. And we pose the question, how gender responsive are the COVID-19 pandemic strategies in the region? To answer this question, we had to define what gender responsiveness means in pandemic strategies. And we turned to the Gender and COVID group, which during the pandemic has developed through consultations with experts on gender and on infectious diseases, what it means for a response plan to measure, to identify, and to address the gender-specific issues faced during the pandemic. And there are 6 dimensions to the index that we developed. 1, we look at whether data is collected on these gender-specific impacts. 2, we reflect on whether access to healthcare is gender equitable. 3, we look at policymaking and ask questions like whether in national executive and legislative bodies, males and females are equally represented. And then we look at safety. Is there access to services for victims of gender-based violence? We look at work. Are there policies that address the challenges in terms of access to work among males and females? And then finally, learning. Is there gender equitable access to schooling? And so we started off with a list of 90 indicators for 34 countries, and we're able to find 39 on which data was available in publicly accessible databases. And we scored on each of these 6 dimensions, countries from 0 to 100. And then for an overall indicator, we also had a score from 0 to 100. And interestingly, we had an indicator, an index that captured performance before the pandemic, say on policies, on budget allocated, on measurement, and during the pandemic, so we could look at improvement over time. And so over the next few slides, I'll reflect on what we found. First of all, before the pandemic, our countries did not do very well, with a regional average of 49 out of a total of 100 that was possible. And we also saw wide variation across countries. On the graph, we see Uzbekistan, which checked off the box on 87 out of 100 of our indicators, compared to Bosnia and Herzegovina, which had a score of 4 out of 100, a huge difference of 84 points. And yet during the pandemic, we also saw a huge catch-up. Illustratively, we have Kosovo on the slide, which before the pandemic scored 13 over 100, but over time, by 2020, has scored 74 over 100 by scaling up access to services for gender-based violence, ensuring equal access to learning for boys and girls, and expanding work opportunities for women. On average, richer countries were more gender responsive pre-pandemic, but the catch-up that we saw was predominantly around poor countries, such that when we looked at the data during the pandemic, we don't see a clear correlation between income of the country and gender responsiveness of their pandemic plans. And so we sort of wrap up as a team, reflecting on what does it mean? What is this process of being more gender responsive in addressing the COVID-19 pandemic and future pandemics? And we think there are 4 important bullets: measuring, consulting, financing, and iterating. The first step is to assess these impacts, to look at males and females and the ways in which they experience healthcare, education, work opportunities, etc. And secondly, to consult experts, to consult the literature. What are the potential policy solutions to the challenges that have been addressed, have been identified? And then third, to develop a plan that is costed and is accounted for in the budget to implement the policy solutions we select, and in the unfortunate event of a pandemic, to implement this response and to continue to monitor the impacts of this response, on the challenges we identified in the beginning. And so just to wrap up, 3 big bullets. One, that this pandemic is not gender blind, and so we have to intentionally monitor and address the impacts of pandemics on males, on females, on gender in general. And 2, that we cannot take for granted that this process will happen, that we have to be intentional about reflecting on the impacts of pandemics on different genders as we draw up pandemic plans and implement them. And third, that even in the poor countries, looking at the catch-up that we saw, that we can do better at addressing gender impacts during pandemics. I want to wrap up by thanking the team, Simi and Hussein for all the hard work on the data, Manuk for the analysis, Azada and Beza who led our consultation and our reflections on what does it mean to develop a gender responsive pandemic strategy. I'd be happy to take questions. Thank you so much for your time.